Well, we're at Hancock Oral and Maxillofacial in Bay St. Louis. How are you, Doc?
Doing great.
So you are Dr. Dan Harris. You're going to tell us kind of what you guys do here.
Yeah, so we have a 3-doctor oral surgery practice. We're all board certified, and we do kind of everything from taking simple exodontia, take your tooth out, all the way to big jaw surgeries where we move people's jaws around, total joint replacements, and everything in between.
So this is the step after you've gone to the dentist. So we're not talking about cleanings and things of that nature.
Right, we don't do cleanings here, and most of our patients are referred from dentists. We're very lucky. We work with a lot of great dentists in the area, and our job is to send patients back to them satisfied that we took care of their more major problems.
And you guys have kind of been in it for a while. This isn't your only location.
That's correct.
It's your only location in Mississippi?
That's correct. We also have a practice in Metairie, Louisiana, and we're opening a new one any day now in Marrero on the West Bank.
Okay, so what is it about your practice that sets itself apart from all the others that are out there?
I would say the culture of our practice. We have like this team culture. First of all, the doctors. You're not going to meet many doctors that get along as well as we do, are on the same page. We have an incredible staff that's very caring, just a sweet, hardworking staff that really respects patients' time and energy.
You know what I think works for that is that it doesn't feel so much like a doctor's office.
Yeah, do you feel like that?
Yeah, and that's kind of what I think pulls people out of wanting to like stay up to date with their overall health. And oral health is a big piece of, oral health is one of those things where if that goes down, everything else can go down after that. But when you make an environment culturally so that it doesn't feel like you're walking into a clinical atmosphere, I feel like, well, how do you feel? I feel like that kind of changes it.
Yeah, I'm very proud of, like, if you look at our Google reviews, we have so many patients that they did not expect this type of comfortable experience. And a lot of people say like they enjoyed or at least were pleasantly surprised at how it went for them.
Well, you mentioned patients. What's the range of ages in patients that you treat?
Yeah, so we treat all ages. One day I actually got to see a 1-day-old child and a 99-year-old person on the same day.
Same day.
Yeah.
That's impressive. I had my, she's about to be 3, but she had to have a lip and tongue tie.
Yeah.
Addressed, and it was like her first dentist visit was 6, 7 weeks old.
Yeah, sorry.
But to articulate your point, all ages. Mm-hmm. Like it starts as soon as you're ready to get them in. That's when that oral health starts.
Yeah, we all have privileges at multiple hospitals, from Children's Hospital to outpatient surgical centers. So whatever you need, we can pretty much do it.
So for oral and maxillofacial surgeon, that's a lot. What made you decide to jump into this industry?
I joked that it had the most amount of syllables in the name, so I thought maybe it was very special. But honestly, it's a fascinating world that we get to live in, where there's really no limits from starting with a major traumatic thing or a major deformity, correcting that for a patient, all the way down to the smallest detail of how their gingiva looks when we're done.
So what kind of training do you guys undergo?
Yeah, so in the United States, oral surgeons will go through either a 4 or 6 year program. I did 4. Both my partners did 6-year programs, and they have MDs. You do 6 months of anesthesia training with an anesthesia staff. You do trauma training, cardiology, internal medicine, a wide scope of hospital type surgery.
And so suffice it to say, you guys are you're the specialist. You're the I don't want to say perfectionist, because you try to be.
Yeah, most dentists are perfectionists anyway. But yeah,
it's like the trumpet player in the band.
Are you the trumpet player in the band?
I'm a singer, but the same thing.
You
right?
had a trumpet handshake.
I did. Right. So. What is the difference, I guess, in a procedure here in your office than in maybe like a hospital setting?
Yeah, so basically the health of the patient might determine their setting of care. We treat a lot of patients with a lot of medical comorbidities. They might be safer to be treated in the hospital. If we're doing a big surgery, we do surgeries where we take your top jaw off and move it into the proper position. That's going to be in an outpatient surgical center or a hospital.
So, and sort of like this temporal mandibular joint thing, do you guys treat those issues as well?
We do. We treat a lot of that if surgery is indicated. And we can do everything from, just like if you hurt your knee, everything from an arthrocentesis, which is a very simple procedure in the office, to a total joint reconstruction, like all new parts and pieces, just like you would get for your knee.
I have that issue, and it never bothers me, but I have nightmares that my jaw locks open. That's never happened. But what is the process of fixing something like that?
Yeah, so they're stuck open, they're stuck closed. One, prevention. Number two, depending on why it's getting stuck open, that would be basically like a dislocation of a shoulder. First, you've got to reduce it. So we do that sometimes in our office, sometimes in an ER setting. But then if it continues to happen, there are surgeries, there's different types of surgeries to reduce that.
So in addition to that, what is the other gamut of procedures that you, or other types of services that you offer here?
Yeah, so pretty much anything that's surgically related, like below here and above here, from trauma to dental implants to wisdom teeth. And you know, we have the privilege of treating patients with sedation in our office. We have very strong training for very high safety outcomes for that.
And you guys are administering that?
That's correct, us and our team as well.
Sure. And so whenever you have patients that come in that have kind of started the process and went through, regardless of how long it is, through the process of whatever their treatment is, what are they saying as they're leaving?
Yeah, so you know, if they're just walking out sedated, they're saying very hilarious sedated things.
Right.
But I think most patients at the 3-month mark, even if we did the most invasive seeming surgery to them, I think most patients come back and say that they're very glad that they went through that and they would do it again.
So if a patient is at a dentist and they've gotten a referral, but they're nervous, they don't want to, you hold that referral in your hand until you go in, they just get nervous. What do you say to those patients that are kind of on the line of whether or not I go through with this or I don't, I'm not excited about this process? What do you say to those patients?
Yeah, a couple of things. The longer you wait, the worse it gets. You know, we have these patients that are like your straight A front row students, you know, with the apple in their hand. Those patients never have major problems. We fix little things before they're big. The patients who put it off for multiple years and kind of ignore it, those are the ones that have a really bad visit. And our goal is to streamline that and prevent that for them. The other thing I would tell them is we communicate really well with our referrals. When a patient gets here, we already have their x-rays up on the one monitor. We already have the referral. We say, like, we know what your dentist wants for you. And we feel like we're the best at doing that for you.
Absolutely. Dr. Dan Harris, Hancock Oral Maxillofacial Surgical Associates in Bay St. Louis. If you have any questions, if you got that referral and you're just kind of waiting, you don't know if you're going to do it, give them a call. You see that phone number at the bottom of your screen. You see the web address. It's all there. Give them a call, even if you just have questions. Consultation, they'll chat with you, and they'll put you on the best path to overall oral health. There's like a mental health thing involved too, because your mouth is your smile, and
no doubt.
it's worth $1 million, right?
No doubt. No doubt.
We appreciate your time here. Like I said, give them a call. They'll be able to help you out. Thank you.